Aesthetic medicine is massive these days. We're talking Botox, we're talking lip fillers, we're talking everything. Last week, I got the chance to speak to Dr. Sarah, who now runs her own private aesthetic medicine clinic, despite only being qualified for the same amount of time as me. If you're a healthcare worker and thinking about it yourself, this isn't one to miss. Sticking with that topic, I just wanted to talk to you about aesthetic medicine. Obviously, it's increasing massively. How did you end up then going about becoming an aesthetic doctor? And can any doctor do that, or can any nurse do that, or what's the sort of breakdown of that?
Yeah, so any doctor can do it post F1, and nurse prescribers can do it, and pharmacist prescribers as well. And it's actually quite an unregulated industry, unfortunately. There's a lot of pressure to try and make it more regulated. So hopefully it will become a safer environment for patients, because there are a lot of people that are doing it that aren't actually qualified, like beauticians and people who, I don't know how they're getting their hands on Botox because it is a prescription drug. But yeah, how did I get into it? So I actually came across a dermatology consultant when, it's a very convoluted story, but I'll give you the short version. It must have been when I was in my F3 and I was applying to a locum agency. The lady that interviewed me for this locum agency was a doctor herself, and it turns out she was a consultant dermatologist. And I was like, why are you interviewing me for a locum agency? You're doing this admin role. And she was like, well, I'm from South Africa and I'm waiting for my equivalent licenses to come through from South Africa to be able to work as a consultant here in the UK. So I'm just doing some admin work in the meantime. And I was like, wow. And so we ended up going for a coffee, and she was very kind to let me pick her brains and ask her all about aesthetics, because she does that in South Africa. And she was basically like, do it. It's amazing. You get really good results for patients. It's a wonderful area of medicine to work in. Go for it. So she really encouraged me and gave me some ideas and advice about the kind of courses that you need to be a safe practitioner. And I went from there and did a course down in London, the advanced training course. And then since then I've done some other courses to kind of upskill a bit. But yeah, if anyone's interested in getting into aesthetic medicine, I would say go for it. If it's something that you feel passionate about, then it's a great industry to be in, but you do have to have a bit of a business mind about you, because no one's going to find clients for you. You have to do that yourself.
And so, just on that course aspect, is there like you mentioned it's slightly less regulated, but is there a sort of standard course that you have to do, and then is there any, do you have increased indemnity, or is there, companies that look after that, or? Because I think that is the thing that I imagine stops a lot of people from like inquiring a bit more, is just the unknown of what that framework looks like.
Yeah, sure. And that stopped me for a while, and I was really grateful to be able to have this chat with this dermatologist about it. There is a course, there's like a very minimum basic course that you have to do, where you've got like a load of pre-reading to do, and you go and do some practical skills as a basic thing. And then there are further courses that you can do to go on to do like the non-surgical rhinoplasty and those kind of things. I don't offer those sort of treatments, but yes, there is a standard basic course to do. And in terms of indemnity, you do have to have extra cover. Your cover that you have just working as a doctor in the hospital will not cover you for private aesthetic work. So I pay, I think it's about £600 a year to be covered to do the treatments that I do. And then it's just about, similar to other areas of medicine, it's about keeping your knowledge up, going to conferences, networking, keeping your knowledge and skills up. But it's a really interesting area to be in, because working in private practice is so different from working in the NHS, because you obviously set your own hours and that kind of thing. But you also have to think about, like I've mentioned, finding your own patients. So you're having to deal with all the marketing, business side of things, and talking with your patients before their appointment, doing the follow-up, and then dealing with the admin side of things, how you schedule your appointments, where are you going to base your clinic, how much is a good amount Are you being scammed for how much you're paying in rent, that kind of thing, and ordering all your supplies, buying the prescription drugs, making sure you've got all the emergency kit. There's loads to think about, and I just kind of figured it out as I went along. So it was
Cool.
it's hard, but it's paid off and it's fun.
No, that's really cool. And what I'll do is I'll speak to Sarah afterwards, and we'll link the course down below and maybe some essential links that may be helpful.
So I hope you enjoyed that conversation with Dr. Sarah about aesthetic medicine. Go check out the full conversation that we had on her channel. We cover a load of topics and it's absolutely brilliant conversation. I really enjoyed it. I want to thank Dr. Sarah again for having me on the channel. My girlfriend's going to kill me. I hope this stuff isn't too expensive, and I'll see you in the next video. Cheers.